The Massachusetts Medical Society just put out a statement saying they are facing a dire shortage of personal protective equipment for people, and physicians are still struggling with a shortage of testing kits. What is your response to those two?
First of all, one of the main reasons we put the command center together in the first place was to have a single point of contact for dealing with many of the issues related to the healthcare response. And I can tell you, having now talked to or been on calls with probably more than 40 governors over the course of the past 10 days, the PPE issue, the personal protective equipment issue, is the #1 issue nationally among all governors, all states, and probably all provider communities, followed very closely behind by the issue associated with the availability of swabs. These are two issues, along with some of the other issues associated with heavier technology like ventilators and that sort of thing, that are absolutely top of the pile with respect to every state, every provider right now. And I think it's critical that the feds move a lot faster on this stuff.
What does this mean for our hospitals as these cases continue to increase?
Well, I think it's particularly important to remember that one of the things that happened was it a week ago now? It wasn't even a week, maybe 5 or 6 days. We changed our guidelines, as did many other states, with respect to the change in the CDC guidelines with regard to who could get the test. We did that.
Last week.
That was last week. We did that so that we would be able to make the test available more broadly, and people have responded to that, which is why the testing numbers are going up. But it's also an issue with respect to making sure we have the supply that's necessary to actually do the tests. And that's an issue here. It's an issue everywhere. And believe me, on every call with the feds and every call with the governors, this is what we talk about.
Governor, did someone here at the State House test positive for coronavirus, and did you or anybody on your staff have contact with that person?
I can't answer the second question because I don't know who the person was, but I can tell you that the Speaker's office put out a statement about 2 hours ago that said that somebody who worked on staff in the House was in fact tested positive. But he also said in his statement that they've notified anybody who had personal contact with them. I didn't. I know the Lieutenant Governor didn't.
Governor, what's the process for, I guess, if there is a way sort of to rally those who contacted the department saying they want to help with daycare and child care for frontline healthcare workers or emergency personnel?
Yeah, that's being worked through the EEC, and they've been spending literally the last 3 or 4 days in a pretty intense conversation with the child care provider community generally to both scope out which sites were most important with respect to the ability to continue to meet and support essential workers, and secondly, which provider organizations were willing to step up and do it, which employees of those organizations were willing to step up, and then finally, to make sure that they implemented the advanced guidance that we put out almost 2 weeks ago now with respect to providing that service. But we spent a lot of time yesterday on the phone with the commissioner, and I think she's pretty plugged into the community at this point and knows generally where the sites are going to end up, which organizations are going to be involved, and those organizations, for the most part, have a pretty good sense about who's going to be staffing and supporting them.
Governor, I was going to ask, what was the basis, as far as you know, for the DOC issuing an administrative directive for a moratorium on staff suspensions or discipline?
I can tell you that the DOC has been taking a lot of guidance from the folks at Public Health with respect to almost all of their policies and procedures around managing inmates and managing their facilities. On that one in particular, we'll have to get back to you.
Governor, as you mentioned, the RMV is still open. A lot of people are going there, but there are some incredibly long lines in Brockton, for example. Are you concerned about how many people are showing up?
Well, first of all, one of the decisions we had a long talk about was whether we should continue to retain operating offices with respect to the registry, and basically concluded, based on the conversations we had with a lot of the folks who rely and depend on that service, that we needed to do it. We only opened a small number because we picked the ones that were very big, very spacious, and had the capacity to create space with respect to the issue that the Secretary mentioned with respect to how far apart you want people for social distancing purposes. That creation of space all by itself creates lines, because you put 5 people in a line where each of them is 6 feet apart, you got a 30-foot line. I think we are expecting and anticipating that people would use the sites. That's why they're open. But that we needed to make sure we created a lot of distance between and among customers and the folks working on the other side of the counter.
Is there any advice you can give to people that feel like they need to rush out there, at the same time?
Well, they're going to be open, but there may in fact be a line, and if there is, you're going to be asked to stand pretty far away from the person who's in front of you, and the person behind you is going to stand pretty far behind you.
Governor, the state is going to take an economic hit from this as well as businesses and
Sure.
individuals. Do you anticipate that the state's going to have to dip into the stabilization fund?
We're running all kinds of models at this point, and we're doing that in conjunction with our colleagues in the House and the Senate. The House obviously is the next step with respect to the state budget generally. But I think you've heard the Senate President, the Speaker, the Lieutenant Governor, and me all at one point or another over the course of the past week or so say that we take a lot of comfort in the fact that we managed to sock away $3.5 billion in our rainy day fund. I don't think anybody's made a decision at this point with respect to how that might get deployed or how much of it might get deployed or when it might get used. But I certainly think all of us are well aware of the fact that the economy is going to take a big hit, tax revenue is going to take a big hit, and we have a whole bunch of services we need to continue to provide to people.
It's a rainy day fund. Is it raining?
I guess what I would say on that one is we need to continue to do the analytics on this with our colleagues in the legislature. One of the things that's very complicated about this, especially when we deal with the public and we deal with the media, is no one's ever been here before. The question you asked me yesterday about, well, what about this line or that line or this line or this one? It's a tough question to answer because for the most part, people are working their way through this for the first time. That's why we're having literally daily discussions with the Ways and Means Committees and ANF about what's happening, what can we learn from that, what do we think it means for tomorrow. And I think at the end of the day, what we'll do is everything we can to make sure that we provide the support that we need to provide around services, that the Command Center and the Department of Public Health do what they need to do to work with the healthcare community to anticipate the surge that I think we all believe is coming, and that we have the resources available, in part because we have a very significant rainy day fund to be able to meet the requirements that are expected of us.
Governor, back to the daycare announcement, just so people can hear it specifically, obviously first responders, those who are healthcare workers, but what about people in transportation who work at a grocery store?
No, it's going to be more than just those folks. There's going to be other essential folks who provide essential services who are going to be part of that as well.
What about there have been some calls to utilize university infrastructure, dormitories, things like that, to help relieve some of the housing stress on the medical side of the infrastructure?
USB, I know you guys have been talking to them.
So the emptying out of the dorms creates opportunity as potential overflow space and space for healthcare workers and the like, and it is actually very much on our list of opportunities. I mean, out of every challenge sometimes creates an opportunity, and obviously the empty dorms has created opportunity for us for not just healthcare workers, but other essential staff, as well as potential overflow space if we need it.
The universities are cooperating with these plans?
The universities are part of our planning process. I'm not going to do it all by myself.
What's the turnaround time for testing and results right now? It seems to be more than the 24 to 48 hours we've been hearing.
I think it depends on who is doing the test.
Right. So our state lab turns the test around between 24 and 48 hours. Some of the commercial labs are 3 to 7 days. And also depends on the priority of who the test is coming in for, whether it's a first responder and the like.
Governor, some people are advocating that you should use your authority to release some people from jails who may not need to be there right now. Have you thought about that? Have you been urged to do that?
I think you're the first to bring this up. I think one of the things I would say is our goal on almost everything associated with 24/7 services is to pursue whatever kind of guidelines and recommendations we get from the public health folks, period.
Last question.
Governor, for the daycares that remain open, will there be similar restrictions to keep a certain number of children in those daycares and have social distancing for those kids? Their parents are obviously on the front lines of this and could be exposed to it. So is there going to be extra precautions taken for those daycares?
Yeah, we issued through the Department of Public Health an updated set of guidelines around child care provisions almost 10 days ago now, I think, and they would have to comply with those, yeah. Thanks, everybody.